So we're going to get started. I'm Katy Masarirambi. I'm the Senior Manager for Social Work at Fresenius Kidney Care. Thank you guys for joining. So we're going to talk a little bit about advocating for oneself when receiving care. So speaking about and being an active participant in healthcare really matters. So I want to start off with a quote. Our lives begin to end the day we become silent about things that matter. So for our agenda today, we're going to talk about why advocating for oneself is important in healthcare, planning for appointments, tips on self-advocacy, and shared decision-making. And then also we're going to touch on unconscious bias. So I want to hear from you guys. Why do you think it's so important to advocate for your own healthcare? Yeah, say that one more time, that you're the only one to do it. You're the only one to do it, exactly. You're the best interest at heart. Yeah, and you know your body, you know what's important to you, and you know your body as well. So we're planning for your appointments, right? So what can you do as a patient to plan for your appointments? So doctors, dietitians, social workers, and nurses, they come in when you're talking to them, they come in with specific assessments. They're going to ask you specific questions when they come and talk to you. So why not as patients, why don't we do the same? Why don't we take 5 minutes before you go to your appointment? Think about what questions you're going to ask and what's the outcome that you want for that appointment. So if you're going into the appointment, say, okay, what do I want from this doctor? What do I want from this treatment? What is my goal being here this day? So once your doctor does their assessment on you, make sure they understand what you're going through, what you're asking them to. So if you're going in there for some specific symptoms, ask them to repeat for you what exactly they're asking for you as well. So summarize what they have asked them to summarize what they heard you say to ensure that they really understand what you've told them. Summarize after they've provided you information, summarize what you've heard and ask them what their next steps is. For instance, for dialysis patient, also ask them about your value, let them know about your values. What's important is that, because that's important sorry, let them know what your values are, as this is an important step in deciding what care you need. For instance, in dialysis, their different treatment options will be part of your life. Maybe you value your flexible schedule, being able to go out of town at a short notice. Will those values be aligned with the current treatment, or will they differ? Maybe you want to go into treatment and just be able, right after work, and be able to sleep through the whole treatment. Maybe you want to be awake through the whole treatment, be able to see everything. Maybe you want to do your treatment at home so you can have the flexibility to change that time during the day. But you really have to let them know what's important to you and what your values are for that. And if those values are aligned with the current treatment of the course, or if it's going to differ. And if it differs, ask the team what other options there are. Ask them where you can find credible information regarding the diagnosis or the treatment. If you're being prescribed a medication, a diet, a test, a treatment, summarize what you heard, what the need is, and then ask them how many times you'll be needing to take it. Ask them to write it down for you. If you're changing your medication when you're on dialysis, ask them to write it down for you. You see doctors very quickly, especially during treatment. Ask them to change it, ask them to put it in writing. So you're making sure you actually understood and you heard exactly what they're saying. When you're given a new medication, ask them the cost of the medication. Before you see if there's a way that they can call the pharmacy before you actually leave the doctor's appointment. If they say, no, they can't do that, ask them who you can call. If there is a problem with the pharmacy, what's the name of the person you can contact, the phone number who you can contact with a doctor before you leave that appointment, so that you can get that medication so you don't have to wait for your next appointment. There's lots of medication assistance programs, but they need to be filled out by the doctor. And you don't want to wait until the next appointment to get that medication as well. Insulin can be very expensive. There's a lot of assistance programs for insulin as well, but they all require to have that filled out by the doctor as well. So you really want to be proactive in how you can get your medications. Medicare Part D. Medicare Part D has open enrollment every year in between October 15th, usually to around December 7th. Instead of keeping the same plan every single year, ensure are you calling Medicare, confirming that this Medicare plan that you have Is it the same plan that's good for you this year as it was last year? Be proactive in it so you're not just giving the same plan next year. If your doctor tells you to take another test, ask the doctor what instructions you need to take before the test. What do you need to bring to the hospital, the medical officers? Medical records. Usually medical records have a cost to them if you want your medical records. However, if you're going to if you just want them to be sent to another doctor, that should be free. So you shouldn't have to pay for it. So if your doctor says you wanted to go to another doctor, you don't have to ask them to send them to you to send them to another doctor because they're going to charge you. But if you say, okay, for continuity care, send it to this other doctor, it should be free. Hospital medical officers are required to provide an interpreter. And if one's not provided, make sure you ask for one if you need one. And it's state law that they have to provide one for you. So now the National Kidney Foundation provided some tips on self-advocacy on their website. So I thought I'd go over them as well. So tip 1, gather your medical records on an ongoing basis. You may need them for a variety of reasons, from insurance, appeals, to getting a second opinion. When the doctors do labs or other diagnoses, I ask them to have my lab or diagnostician copy me on that report. Although I don't have all the doctor's office notes, I do have the study and the reports of what I consider the essentials. They gave a tip 2, keep a list of your medications. Update the list when you go and make any changes. If you go to any doctor's appointments or hospital emergency rooms, bring it and take it with you. And even better, keep the list in your wallet with your insurance cards and in case of emergency of all times. Tip 3, keep a list of your doctors and contact information on you at all times. Put them in your phone. You list them under doctor in your phone, rather than having them by name. So if there's an emergency, someone can check the phone of all your doctors. Make the contact information easy to find. If you have an emergency contact, put them under emergency contact as your phone. So if there is an emergency, they can get a hold of them real quickly. Tip 4. So when you go to the doctor, take the list of questions, symptoms, any concerns you have. Again, have the doctor repeat after you give it to them. Ask them to repeat to you so that you can make sure that they understood what you're there for. And so they're going by what you want to be and what you're wanting to get out of this appointment as well. Tip 5, remember to take your medications and take them correctly. Errors are very common, but they can be dangerous. And it's important to take the medication as prescribed. Get refills before you run out. Get refills if you're changing plans. If you know your plan is going to change in a certain amount of time, get it right before you change. End of the year, there's a lot of deductibles. Fill it at the end of December so that you can, if you can, fill it for 3 months so that you have it for 3 months. You don't have to worry about the out-of-pocket deductible that comes around in the beginning of the year. I apologize, I've lost my voice a little bit. So lay out the medication once a week. Have a prescription binder, pill box. Have the one that has the 3 times a day, morning, mid, afternoon. Have the 7 days of medication. Lay it out. It helps to make sure that you're taking the right medication at all times. A lot of times in dialysis, they change medications quickly. So how can you ask them if they do, when they're doing rounds, can they give you a piece of paper so they write it out for you if they're changing a phosphorus binder or something, like tweaking a little bit so that you remember it. So now I'm going to move on a little bit from planning the appointments to making decisions. So the National Cancer Institute definition of shared decision making says that in medicine, the process in which the patient and healthcare professional work together to decide the best plan of care for the patient. So when making a decision, the patient's values and goals and concerns are considered. Shared decision-making helps patients learn more about their health condition, the different testing and treatment options that may be available, and the possible risks and benefits of each. And it is often used when important medical decisions are to be made, such as having a genetic test or cancer screening, or having major surgery, or taking some medicine over time. So this process called shared decision-making, it's really the process making sure the doctor knows what's important to you. We often ask doctors, if this was your mother, if this is your father, if this is your child, what would you do? That's assuming that the doctor's mother or father or child is exactly the same and has the same values as our mother, our child, our father. So instead of that, why don't we tell the doctor what our mother, our father, our child holds, what's important to them, what values they have, and what our loved one wants, and ask them if the treatment aligns with if that doctor then feels like the treatment that's prescribed is actually the same, aligning with that values. In dialysis, there's very different treatment options, and each one is a personal decision based on the values. Transplant, home hemodialysis, in-center hemodialysis, peritoneal dialysis, all open up different possibilities to patients. And it's really important when making such a big decision to really see how those decisions will line up to how you want to live your life. So I want to share you a little video to discuss this shared decision making. It is really important and vitally important that you, along with your doctor, are involved in these decisions as well. So, go out of this, see if I do this correctly. All right. Let's see if this will work.
Would you have a haircut without discussing what you want? Would you buy what you're looking for?
Can you hear it? No, that did not work. Okay, I'm gonna try one more time.
Would you have a haircut without discussing what you want? Would you buy a car without discussing what you're looking for? Meet John. At 40, he injures his knee playing football. His GP refers him to hospital, where the doctor offers surgery. But what if the doctor asks John, "What's most important to you?" John explains that he cares for his grandmother, so surgery is not the best option as it means time in hospital. The doctor suggests other options that can get the same results. John decides on physiotherapy and a gentle return to activities. 3 months later, John is back on the football pitch. Let's fast forward. John is 75. He's losing weight and feeling more tired than usual. He has tests and is diagnosed with cancer. Sadly, it's too far advanced to cure. John sees a specialist who explains that chemotherapy is the best option to allow him to live a little longer, though it still won't cure his cancer and will make him very sick. But what if the specialist asks John, "What's most important to you?" John knows he doesn't have much time left. He'd like to spend that time with his wife, rather than have treatment that will make him sick. The specialist and John's GP work together to ensure he can be comfortable and at home. John and his wife are pleased. He has the care he wanted. Healthcare professionals are experts in explaining the benefits and risks of different treatment options. John is the expert in what's best for him. This is shared decision making.
So in with that, it's if the doctor is asking you what is the most important thing, or for whatever type of treatment you're getting, whether it's dialysis, what's important to you when you're getting dialysis? Well, I want to be home for my kids at this time. Oh dear, that did not work.
Well, shared decision making.
Oh,
Which I stopped.
there we go. So what would be that? So that especially when if you're in one treatment already for dialysis, you can switch it at any time because your values are going to change, right? So if you're on dialysis for a number of years, you can change it anytime. And you might want to go back to school. You might want to then, I want to have my nights free. I want to have my mornings free. I want to be able to go up and visit my grandkids in a moment's notice. And different treatment options will help with different things. And so really being able to have that conversation with your treatment team and your interdisciplinary team is going to be really important as well. So we go back. So I wanted to introduce the topic that you may or may not be as familiar with, and I want to discuss it how it relates to self-advocacy and to shared decision making. So Vanderbilt University defined unconscious bias is defined as prejudice or unsupported judgments in favor or against one thing, person, or group as compared to another in a way that is considered unfair. Many researchers suggest that unconscious bias occurs automatically in the brain and makes quick judgments based on the patient's past experiences and backgrounds. So everyone has unconscious bias and there's automatic connections in the brain made without the individual individual knowing it. Many medical institutions are now recognizing how unconscious bias can have a negative effect on patients' health and therefore instituting training to ensure medical providers are becoming more aware of how they may be making assumptions based on patients based on their race, gender, age, sexual identity, and disability, which can have an impact on patients' health. It's important for medical providers to see the patients as individuals. So for you as a patient, the best way to combat unconscious bias is to let them know about you. Let your medical professional know about you as an individual. Let them know what you value. Are they hearing you, and are they taking the time to listen to what you're saying? And if you feel like you're not being heard, ask the medical professional what they heard you say. Most medical offices and all dialysis clinics have social workers. Use them. They're great resources and provide you the support they need. So I hope we can answer some questions for you. We can talk a little bit about one of my questions that you guys might have, but really just remember that you guys are the expert in your own care. Be prepared for your appointment, participate in your treatment plan, to let the treatment team know that you as an individual and really what matters most for you. What questions that you guys might have, we can help about dialysis, about treatments, advocating for yourself. Yeah. Oh, you are? Gotta work together. Yeah, exactly. So yeah, I agree. So they do the commission. Yeah. So that's usually. So the question was. Let me just make sure that I'm taping it too. The question was if the patient, if somebody has like has different shifts. Or if somebody's in the morning shift and now needs to switch to a different shift because of family obligations. And then it has particular hours. So every clinic works a little bit differently, right? So every clinic has a different times that they start. And most likely like that, like for the school, you would want like a mid shift. Like the second shift is usually starting at like 10, 10:30, 11-ish and going to like 2:30, 3 o'clock-ish. So it would depend on the clinic itself, but I would talk to the clinic manager and I think it was great if you start, oh, thank you. Start talking right away about like, hey, next fall, this is what I'm looking for. Because a lot of the dialysis centers obviously they want to accommodate to really be able to still have the family and do what you want to do. Yeah, so I think I would definitely advocate for you to go to talk to the social worker and talk to your clinic manager about it. That's great. Yeah.
Just a minute, I'll bring you the mic.
Thank you.
Hi, Bella.
So I was wondering with the unconscious bias, of course, like patients can speak up, but do you think there's a bigger way to handle the issues with the doctors or specialists having unconscious bias to make it a safer environment in any situation? Like, is there a root issue that we can combat in a certain way?
Yes,
Question.
it's a very good question. I love it. I think that's where we're going. I mean, I think that's what a lot of companies and a lot of medical institutions are trying to. And, I think one thing is making people aware that, that people are even having unconscious bias. I think that's the first step, that if we can just even making everybody aware that this is something that happens automatically. And as long as it is, so if you're becoming aware of something that's automatic and you become aware of it, then you can kind of combat it, right? So we have to be able to work, I think, as a whole society to really be able to then shift to that next level. So I wish I had all the answers for you, but I think the more that we talk about it, I think that's going to help us get to the next place where we want to be.
Great question.
I wish I had a better answer for you.
I don't know how to phrase this. I'm not as good a speaker as my sister, but I have been told that not many patients know that there's a lidocaine cream that can make them more comfortable before they get stuck with the needle. Why is that not more known? Why don't they let patients know, like, they're about to get stuck with this big needle, there's a way that it won't be as painful,
Right. That's a good question too. I think I would say a lot of the PCTs, like the PCTs, when they are, maybe I'm wrong, say that, oh, PCT, the patient care technician. I'm sorry. So the patient care technician, when they're putting the patient on, I think that that's a good time to then start talking about it right away. And if it's not being done, I think we have a good opportunity to try to make that more aware, and I think that the way that it is put on affects the patient as well, because there's different thoughts of how the timing is for it to be effective. You have to put it on a certain amount of time before you get on treatment. And then if you get delayed on treatment and you're not put on right away, then it's going to wear off. So then it's not going to be as effective. So I think that that's a good point, that if we can just continue to make people aware that that is an option, not an option, it's that this is something that's available that we can get to try to make it less painful. I think that's a great takeaway that I'd be happy to take back to my team as well, to make sure that people are letting people know what's available. But I do think the way that we ensure that it's being put on correctly to then actually help, right? Because then you'll have, that you'll put it on, and people put it on before they get on. They'll put it on before they leave the house. And then you get transportation, you get to the clinic, and then you're waiting in the lobby. So then by the time you get on, then it might have worn off. And so it's not as effective. So I think tightening up that time as well. So if we see somebody's in pain, how we can do it. And then I think for patients too, to advocate for yourself of like, hey, this is really hurting, and what can be done about it as well. Because you're not supposed to be in pain when you're on treatment, right? So then that's the problem. That's the thing. Sometimes patients think that they're on dialysis, so you're supposed to be in pain, but you're not, right? You're supposed to be able to have a comfortable treatment. And if you are in pain, then we need to be able to speak up and say like, hey, I'm not feeling well. What can we do about it as well? And feel comfortable. And I guess in our job as medical professionals is to make you feel comfortable to tell us that. So if you're not feeling comfortable in that, what's going on that we're not making you feel comfortable telling us that? Yeah.
I like to get my steps on.
I appreciate the help.
Hi, so not so much a question as, especially to those listening at home, as a reminder, I'm also a Fresenius patient. And, when you first start treatment and everything, I'm a PD
Oh, okay.
patient. That it's also new and you're just taking it all in, and you're just, you're given a nurse and you take it. But, as time goes on, if speaking of advocacy, if you're uncomfortable with who you're working with, that you do have choices.
Yeah.
I switched nurses, but it was scary. Nobody told me I could do this.
Mm-hmm.
And it changed my entire perspective and my entire lifestyle on PD when I switched nurses. You know, I was given her number, her cell phone number, I could text. It was just, instead of feeling like a bother,
Yeah,
which I felt at times,
yeah,
it was, anything was welcome, you know, within reason. And just, if you're unhappy, it's not you. It's probably not you, that you
Right.
can switch nurses, or, you know, if you need to, facilities, but that it's, you know, you already are going through so much,
right.
you know, that if you're unhappy, speak up.
Yeah,
Speak up and change, because it shouldn't be yet another, you know, detriment to your life and your lifestyle. So just as a reminder, because nobody told me that. I
yeah,
didn't know.
yeah.
You were just putting up with poor treatment. Yeah, bad treatment. You know, whether it's, you know, bias or whatever, but yeah, just know that, yeah, don't just go through the motions, you know, find people that you can, you know, feel comfortable with, and makes your treatment so much more manageable, and, you know, to be able to live your life in the way you were accustomed to beforehand. So speak up.
Great.
Speak up, because as we said when we first came in, no one will do it but you.
Yeah.
They don't know
Right.
except you. So that's all. Less a
No, I
question other
love it.
than,
No.
you know, speak up. Some things you find the hard way.
Yeah, and I think as medical professionals, we need to make it more comfortable for people to speak up, you know, and I think that's what we're really trying to do. And how can we help to make people who, you know, if you are uncomfortable, if you're in pain, you know, how can we make sure that you're comfortable telling us that, so you can get a good treatment? Thank you for sharing that.
I think it was November last year. So I was a home hemo patient, and it's actually really good. I had, you know, a good support system. I was doing it at home. We picked up and went to Florida on a road trip in an RV, in an
Yeah.
RV with all my machine and everything. And I went to my mom's house for Thanksgiving. I spent the whole month with her. My father's garage looked like a medical supply company.
Yeah.
But I switched back to in-center because I just wanted to separate
Mhm.
my life
Yeah,
from my dialysis, you know, so I just wanted a separation. I didn't want the kids to see all those boxes in the house. So I decided to switch. I mean, I'm a nurse. I could do it at home. I poke myself just fine. Or my son was poking me. And it was okay. But I decided to go back in center. I felt like it was just a better choice for me.
yeah,
But maybe sometimes, like my doctor, he's like, well, you should go back on home hemo whenever you feel like it, you're a chicken. But home hemo is really good too. You know, like,
Yeah.
I mean, you got a good support system. So I got to know really good nurses. So
oh, that's great. And I think, that's a good example of it. You're able to change based on what you need right now too, right? So if you need that flexibility to do it at home, go home. In a couple of years, okay, now I need to just really separate everything. I just need it, you know, like I'm here doing my hours, going home, done, then that's fine too, you know, but you have to be able to tell what's important to you, and be able to then feel comfortable to feel like empowered that you can say that as well. Yeah, that's really good.
And I'll also just say that, you know, knowledge is power. So kudos to you all for being here, for learning more. Every time you go to an educational program or anything you can do to further empower yourself is so important. And I encourage you to take it back to others, share with others who aren't here today. Let them know that these programs exist so that they can be empowered. The dialysis centers and the transplant centers are really busy places. And even the most well-intentioned professionals who will sit and spend extra time with you. And I've been fortunate through all of my journey to have great professionals, but I learned so much every time I come out to a patient program where people take time out of their busy schedules to come out here on a Saturday and talk to us specifically about one topic, encourage us to advocate for ourselves. So for everybody who's either on Zoom or right here in the room, I'm so happy that you have joined us today, but please encourage your friends and I encourage you to keep up with us in KFI online and share the information with others who can use this information too. That, advocate for yourself and advocate for others that you know who need help. That's also very key.
Well said. Thank you very much. The last thing I'm going to say, because then you had a good point about about being stuck. You mentioned about sticking your, that you have no problem sticking yourself in the arm. That's your lifeline, right? Dialysis in center, that's your lifeline. Home hemo. Learn how to stick yourself. If you have an access that it is hard, and you're like, okay, I'm gonna have this one person stick me. Learn how to do it yourself. Don't have anybody else, that if you know your arm, you know your body, you know your bloodline, have it done yourself too. Some clinics still let you do that. So you have to go training. Do you do it yourself? No. See? Okay. So then you're like, okay, I feel comfortable doing it. Yeah.
I'm sorry. One is observation. Can you understand me?
Yeah.
I had a stroke and it's a little. I learned how to stick myself almost 10 years ago. They had a new tech and my regular tech was on vacation. And I told her, it's right, my graft is in my leg. And I told her, it's right there. You don't let the side of my leg have unconscious. As I told her, it's right there. And when you feel a rush, right there and right there. And she didn't listen to me. And yes, and I was going to smack her. I'm serious, but I was, yes, and she moved back because I told her 3 times that right there, and she did it. And I said, I want to learn how to do.
Good. Yeah.
Now it's almost 10 years later, I can do myself when I feel like it, or they're in a hurry and I just do myself. And that's good. But the other thing I want to just ask you and everybody around, I lost 2 of my best friends, 4 years and 10 years, and they didn't die from COVID, but they had emergency and they died like that. It was my, best buddies. They was not on dialysis, but I can talk to about dialysis. And now I feel lonely and I miss them, obviously, but I don't have anybody to talk to about dialysis when it's really, I have low blood pressure and I faint once in a while, or I have bad sessions. And when I want to talk to other people, it's nobody around. And I know my family likes me and loved me. That's 2 different things. You can love a person, don't like them, but they like me and love me, but they don't want to hear about dialysis. They don't come to my center when you could. When people come and just sit before COVID. My niece did it, or my other niece, but not my friends. And it's like, oh, my question to you and everybody else. I'm sorry, I took the long way, but how do you have somebody to talk to about it? I tried to, my friend, well, acquaintances, they don't want to talk about it. Once they leave the center, they don't, but I need it. And I don't know how to make it for myself. I tried to go online and only thing I reached was dating. I don't want dating. I just want,
So I think you got a couple of answers for you. And then, yep.
Did you?
Couple responses, yeah.
Right quick. So I'm just finding about the National Kidney Foundation basically today by coming. But I've also known about the network, the renal network. They have support groups for people to talk who share dialysis, who you need to talk about different things. They have exercise classes, arts and craft classes. So they have all of that available to renal patients as well. Yeah.
So maybe you can share that information with her so how she can get connected. Thank you.
NKF has a support, peer-to-peer support group as well. So National Kidney Foundation, they have a peer-to-peer, so you can actually get hooked up with one person as well. And I think we got another resource for you too.
So through a friend,
Yeah.
I've been like when there's dialysis patients that are depressed or anxious or are just starting, I'll talk to them through, their anxiety and for transplant, process, or if they starting the transplant process, they don't know how. But for the buddy system, I'm in a support group on Mondays. People call from all over the United States, and we all talk in a Zoom so we could see each other, right? And we kind of let out our feelings or what we're worried about, and people just talk to each other, and we're real,
Oh,
not anything like you talk about what you want to talk about that day. It's Mondays at 6 o'clock. Mondays at 6 o'clock. Yeah. Well, you could do it on your phone if you want to.
Where could she find that info?
I could give you the information on
Oh.
it. I don't have a card on it, but I could give you the information.
Yeah.
And it's just kidney patients. It's like no really, like there's one person that moderates it,
Mhm.
but and then we all decide like in a group what we want to talk about the next week, or some, things that we found that were more patients were asking for. And then we
Nice.
would just all do our little research and come with a solution for it
Oh,
the next
great.
week. So
Very,
it's like you're doing something and you're also talking to people in a support group. So it's kind of good.
that's wonderful. And then the NKF has the peer-to-peer as well. So National Kidney Foundation, and even on their website, it's peer-to-peer support group support, so that you get hooked up with one person and so you can talk to them. And the dialysis social worker would have a lot of these resources too. We are trying to start some virtual support groups as well. Still coming. We had one for a little bit, but we had some clinics that had some support groups in person, and obviously that kind of got thrown off with COVID. But yeah, that's great if you could share that information. And then the NKF peer support group, and then ask the dialysis social worker too for more too, because they should have a lot as well. Great.
And I'll just say that lunch is ready outside. And so when we leave out of here, you guys can grab your lunch and go into the ballroom after we wrap up.
Thank you. I appreciate you guys' time and all the questions as well, and sharing the information as well. Thank you. Nice to meet you all.
Thank you, Katie.
Say that again.